A U.S. task force is now recommending that adults ages 19 to 64 get screened for anxiety. Local psychologist Dr. Tracey Packiam is joining us via Zoom this morning to break this down, this new recommendation. Good morning. Thanks for being with us.
Good morning, Jen. Thank you for having me.
So this was released Tuesday. It's really a first of its kind recommendation. Why is this so important for patients and healthcare providers?
I think the first thing to know about anxiety is that there are two sides to it, as most mental health issues. The first is anxiety can actually be proactive. It can propel us into providing positive action. But the flip side, the negative side, is that it can be paralyzing. And being able to identify that early is such an important step because it can show up in so many areas of our life, in our work, in our relationships, our daily life. And the earlier we screen for that, the earlier we can identify ways in which we can learn signs and acquire tools to manage our anxiety in a healthy way.
Well, it's interesting, too, because, some people may look at anxiety as I'm anxious about an interview I have tomorrow, as an example. But others, it can be more severe, as you just mentioned, and paralyzing. I mean, does it have long-term ramifications to our health if we don't treat it?
It certainly can, Jen, and I really appreciate the example that you shared. The anxiety about an interview is a great example of a proactive or positive type of anxiety. So anxiety is that alarm system in our brain that tells us, hey, we have to watch out for something. And having that small dose of anxiety can propel us into action. It can help us prepare effectively for an interview. But the negative side of that, it can lead to long-term effects, as you asked about, like perfectionism, where we have to have everything so perfect that it actually prevents us from doing anything. It can also show up in procrastination. Some of us put off doing things because we're so afraid of failure, and that anxiety becomes crippling or paralyzing. So those are negative long-term effects of anxiety, where we don't do anything, we are paralyzed, we procrastinate, or we can even use perfectionism as an excuse to prevent us from doing anything.
So are those some of the warning signs, and are there any others that the anxiety we're experiencing is not proactive?
That's such a great example. When we look at standardized screening, as we're talking about here, of anxiety, typically the research looks at two ways in which we can identify anxiety. One is physiological signs. So it looks at things like heart pounding. Do you have hot or cold sweats? Do you notice your hands trembling or shaking? The other part of that is the cognitive signs. Do you notice yourself feeling scared more easily, constantly feeling nervous? So these are some of the ways that you can do a self-check to identify your own levels of anxiety.
So if someone is feeling the anxiety that you mentioned that really needs to have some kind of intervention, what kind of doctor do they go to, and how are they screened then? What is that process like?
The easiest way for a lot of people is to first start off with their family doctor. They may feel more comfortable. It's a familiar face. And you remember that anxiety is already, it can show up in different ways. So we may have anxiety just even about finding someone new, like a therapist or a psychologist or a counselor. So some people might go to a faith-based person that they're comfortable with. They may go to their family doctor. And usually, a family doctor will look at, much like we talked about, the physical signs. It'll also ask how it's impacting their daily functioning. And that's where that paralysis, that crippling effect comes into play. We generally feel anxiety about things, but is it actually preventing you from performing well in your workplace? Is it preventing you from establishing new friendships, new relationships? What is the impact that anxiety is having on you? And that second follow-up question is really crucial. So it's not just being able to identify the signs of anxiety, but also to identify the impact anxiety is having on your daily life.
Local psychologist Dr. Tracey Packiam, thank you for your time this morning and perspective.